The lymphatic system. Let's start with the 1, 2, 3 functions of the lymphatic system. They are.
It's on us.
Clearing out waste.
Gotta get more specific than that. 3 very specific functions. Nope, that's your cardiovascular system.
Tells you on your immune defense.
Okay, so that is your last one. And it's intimately associated with the immune system. Why? What is it about these organs that make it intimately associated with the immune system?
White blood cells.
What about white blood cells? We're going to practice this so you understand why. What is it about the lymphatic system and white blood cells?
Does it produce white blood cells?
Nope, doesn't produce them. You're going to produce them mostly in your bone marrow along with the red blood cells.
Bones.
Do you have white blood cells everywhere in your body?
Yes.
Yes. So what makes the lymphatic system unique compared to the rest of your body and white blood cells?
It has the majority of them.
Unusually high populations of white blood cells reside in your lymphatic organs. So if you have like, I don't know, I'll just throw out a number, 10 white blood cells per inch in the rest of your body, you've got 100 or 1,000 in your lymphatic organs. So unusually high populations of white blood cells. That's number 1, immune defense. What are your other 2 functions of your lymphatic system?
Regulation of interstitial fluid.
Yep. So it drains 3 to 5 liters of excess interstitial fluid from your body each day that doesn't get reabsorbed by the blood vascular system, by the capillaries. What is the name of the condition which is created when you do not reabsorb that excess interstitial fluid?
Edema.
And you have edema. What would be 3 causes of edema in the human body?
Trauma.
Okay, more specific than that. Because that's going to trigger more inflammation than edema.
Diabetes.
Diabetes. When people have full-blown diabetes that's uncontrolled, they'll often get fluids accumulating in the bottom of their legs because they're damaging their blood vessels.
Not moving.
Okay, more disease processes. Congestive heart failure, because if my heart is not generating enough pressure to pump the blood to my bottom of my feet and fight gravity on the way up, gravity will keep those fluids contained in the bottom of my feet, creating edema. And
Age.
now something specific. Remember the guys whose scrotum was hanging down here on the ground? What the hell is going on?
Oh, Titus.
Parasites. Parasites can crawl up. You guys remember that scrotum that was hanging down here? Remember that picture?
Sure.
How could you forget that? Your scrotum is not supposed to scrape the ground. And remember the old lady? Her arm was all swollen up. What was wrong? Lymphedema. Specifically a subcategory of edema caused by the removal of
Lymph nodes.
lymph nodes. That would be it. Okay, what's our 3rd function? We also covered it. What? Absorption of fats. Okay, why? Remember the villi in the small intestine. In the middle of the villi was that green vessel called a lacteal. Why did we need a lacteal to absorb fats in the middle of the villi?
So it can pass into the blood capillaries?
It can't pass into the blood capillaries. Now let's go back. Why do we need the lacteals?
Absorb nutrients from our mom's milk.
Okay, so we've got, here's our villi. that villi, we had capillaries, and we had some venules. And in the middle, we had this lacteal to absorb fats. Why do we need this lacteal? How come the capillaries don't just absorb the fats for us?
Because wouldn't the fat like block the capillaries?
Why?
It's too big.
Size. Triglycerides, which are the major type of fat that we absorb from our diet, are very, very large molecules. Bigger than a simple sugar, bigger than an amino acid, so we have to have a larger vessel to absorb that. Okay, we learned about two major vessels of the lymphatic system. One vessel returns lymph from my lower half of my body and this side of my upper body. What's the name of that vessel? Has to do with this cavity, thoracic duct. And then this one on this side is called the
Right.
right lymphatic duct. Both of them end up returning the lymph into what vessel?
Your hepatic, subclavian.
Subclavian veins. That's where the fluids go back in each and every day. Okay. What type of white blood cells would I find in a lymph node?
What type of what?
What are the specific names of the types of white blood cells that have a preponderance to hang out in your lymphatic organs and your lymph nodes? There was 4 different kinds of white blood cells that we learned about. M word, macrophages, generalized phagocytes that will gobble up pathogens and cellular debris. And another one that we learned about hangs out underneath the skin, and when your skin gets cut,
Dendritic cell.
dendritic cells, they will then migrate to the lymph nodes, and they then present chunks of that pathogen to the last 2 types of white blood cells, which are very specialized in their functions. They are named after the alphabet. B cells and T cells. Your B cells are going to make antibodies, and your T cells can attack virus-infected cells of the body. All right, what does structure A represent?
Lymph nodes.
Tonsils. Those are not lymph nodes, those are tonsils. And what are the names of the tonsils that most likely would cause somebody to have sleep apnea and extreme snoring problems?
Adenoids.
The adenoids, also known as pharyngeal tonsils. Then structure B represents the
Thymus.
thymus. The job of the thymus is to produce what? Yeah, specifically. How does it help with immunity? Because all these have to do with your immune system.
Are they produced to be in T cells, okay? Yeah.
Part of that. Only one. They produce functional populations of
T cells.
T cells. So they don't have anything to do with D cells. It is not producing them, it's educating them. Because T cells have the ability to attack your body cells. If your body cell gets infected by a virus, the only way to get that virus out of your body is to destroy that cell. So the cells that are responsible for destroying virus-infected cells in your body need to know what the hell they're doing, because they can do a lot of damage if they go haywire. So this is basically the schoolhouse for your T cells. We educate them and make sure that they know what they're doing. And that happens most likely early on in your life, from the time you're born until about 20 years old. All right, structure C. Those represent
Axillary lymph nodes.
axillary lymph nodes. What are the 3 locations where you can palpate the lymph nodes?
Your neck, your
Cervical,
axillary,
axillary,
groin.
and in the groin region. And we already covered the types of white blood cells that we would find in there. Structure D represents the spleen. What are the two functions of the spleen?
Looks.
For pathogens.
Yeah, immune surveillance. We're going to look out for pathogens as blood travels through it. What does it do with your blood?
Filtration. Recycles worn out red blood cells.
Recycles your old, worn out red blood cells. When we make red blood cells, they do not have the ability to repair themselves. They eject their nucleus when they are mature. If you don't have a nucleus, you can't make proteins to repair yourself. So when we make red blood cells, we know that their life is finite. They last 3 to 4 months. As they age, they become stiff. That's not cool because your smallest capillaries are so tiny that red blood cells actually have to bend to get through them. And if they get to the point where they're so stiff that they can't bend, then they can't go through the capillaries. So as they start to get stiff, we recycle them. Then structure E represents,
Mucosa-associated lymphatic tissue.
yep, malt. And the specific type of malt which is represented here would be called what? Nope. Peyer's patches. Peyer's patches. Accumulations of lymphatic tissue that line the intestines because there's a lot of bacteria down there. If those bacteria try to crawl across the epithelial lining of your gut, we've got white blood cells. And what if your intestines start absorbing virus particles from, because you get GI upsets all the time. You gotta have some protection. Because this represents the inside of the intestines, represent opening to the outside world. Now, keep in mind, this isn't the only type of malt. Peyer's patches is one example. What's hanging off the end of the cecum, that's another example. The appendix, and then tonsils are another examples of malt. Mucosa-associated lymphatic tissue. Remember, where do we find malt?
In your
Openings of the body.
openings.
Every opening to the outside world. That's where you're going to find malt. And your intestines represent an opening to the outside world because this is simply a tube from your mouth all the way down to your anus. Then, what does F represent? Lymphatic vessels. And is there any pump to the system? Okay, let me back this up. You do not have a pump like a heart on the lymphatic system.
No,
So what causes it to move? Skeletal muscle contractions is going to be one of the 3 ways.
Blood flow. Well, gravity's good back stuff.
What would gravity do?
Pull it out.
It would pull it all down to the bottom of your feet so it'd accumulate and then you'd have edema. That would be when it's not functioning correctly.
One-way valve.
One-way valves, just like veins do. That would be number 2. And third,
Constriction and
a
dilation.
little bit. The bigger vessels have a little bit of smooth muscle in there, and they will constrict to assist with the movement of lymph. But definitely, muscle contractions are going to be the biggest way that you move lymph in your body. That then. Did that. Yep. Got everything from that chapter. So there's one chapter down. Bingo. Chapter number 2. Respiratory chapter. And we start that up here on the board. Functions of the respiratory system. The most obvious function, which we taught you in chapter 1, is
Respiration.
Oxygen.
respiration, which includes ventilation, the movement of air in and out of the lungs, and gas exchange, which happens in the lungs. While that air is moving through the air passages, what will it allow us to do? Speech. What else will it allow us to do?
Smell.
Smell. And if I close off my epiglottis, what else can I do? What?
Expel.
What? Expelling abdominal contents such as feces and little babies. It also respiratory pump. What does that help with?
Bringing blood back to the heart.
Movement of blood back to the heart and the vena cava, and lymph back up into the subclavian veins, because that's part of our pumping system. Helps with homeostasis. How? pH balance by controlling levels of what?
Acid and base.
That's kind of correct, but controlling what specific molecule? You've got the right idea.
Carbon.
Calcium.
Good. Keep going.
Dioxide.
Carbon dioxide. Yeah, between both of you, all three of you, because what you're thinking of is the formula.
Oh.
Carbon dioxide comes out and combines with water to create carbonic acid, which then dissociates into a hydrogen. Here's your acid and a bicarbonate, your base. And so I'm thinking that that's where you were coming from with that. And the last one is really vague. It works with the kidneys to help regulate another homeostatic variable called
Blood pressure.
blood pressure. So, helps with blood pressure. What is the little step that it does? What's that little abbreviation that will help you with this one?
ACE.
ACE. Okay, what does that stand for?
No idea. I wrote it down. I don't elaborate on it.
Angiotensin converting enzyme. It is an enzyme that catalyzes a chemical reaction. Okay, so I'm going to briefly explain this to you, not in the hopes that you will memorize it, but just to try to help you understand what in the hell do the lungs have to do with blood pressure regulation. So you guys already know that the kidneys receive a lot of blood flow, right? If the kidneys sense low blood pressure and they can't filter blood properly, they release an enzyme called renin. Renin acts on a protein that's in your blood. It's made by the liver. It's called angiotensinogen. It converts angiotensinogen to angiotensin 1. Angiotensin 1 then travels through the lungs, where it comes across angiotensin converting enzyme, and it turns it into angiotensin 2, which is the active form, which is then going to pump up your blood volume. And if you increase your blood volume, what would that do for your blood pressure?
Raise it.
It would raise it. So the stimulus that gets that whole feedback loop started is low blood pressure due to low blood volume. All right, so there's your functions of the respiratory system. Let's go to...
Whoa.
That scared me.
Yeah, it's at the very end. Okay, so let's do our labeling diagram to start with. What is structure A?
Nasal
Nose.
cavity.
What is structure B?
Nasal cavity.
Nasal cavity. What functions does the nasal cavity perform as far as respiration goes?
Propelling air and filtration.
Okay, it warms, humidifies, and
Filter.
cleanses the air. What type of tissue lines the nasal cavity? That word from the tissue chapter that you guys are terrified about.
Non-keratinized
Stratified.
squamous epithelium.
Fake stratified.
Pseudo.
Pseudostratified, ciliated, columnar epithelia with embedded
That's not
mucus
what
cells.
they said.
You see, you guys hate that word. I know you do. Pseudostratified, ciliated columnar epithelia. So we've got mucus cells and we secrete mucus in the nasal cavity. So these structures right here, which are called
Oh.
nasal
Column? No.
concha, nasal concha, and then those little cavities in between are called the meatuses. So the concha and the meatuses create turbulence, which causes the air to swirl, throws the debris against the mucus. Mucus traps the debris, and then the cilia will move the mucus into the back of the throat called the pharynx. Now we have to change our epithelia. What is the epithelia that lines the pharynx, since it is a common pathway for food and air? What does it need? And you're eating Doritos, it needs protection. What is the type of epithelia that's one job is protection?
Stratified squamous.
Stratified squamous epithelia. One and only job in your body is to offer protection, whether it's keratinized or non-keratinized. Then the food goes into the larynx. What is the name of the lid on the larynx?
Glottis.
Epiglottis. When the epiglottis closes, it pushes the food into what structure that lies behind that? Into the esophagus. And attached to the bottom of the larynx is the trachea. And then at the base of the trachea we have
Primary bronchi.
bronchi. What type of tissue lines the bronchi, trachea, and larynx? Fake, pseudostratified ciliate and columnar epithelia. That collectively we call all of this pseudostratified cilia the
Elevator.
mucus elevator. So it moves all that debris-laden mucus up into the back of your throat. You swallow it, it goes to your stomach. The acid kills any pathogens that are in there. What provides structure in this region? The bronchi, the trachea, and the larynx.
Cartilage.
Cartilage. What kind of cartilage? What do we call this kind? Hyaline cartilage. And then we also learned what is the specific name of this cartilage? That is your thyroid cartilage. And then what's the name of the little one that's right below it?
The
Oh, it's the one that you can tell.
Eucricate.
Cricoid. The cricoid cartilage. And the reason I pointed that out is if you need a cricothyroidotomy, in other words, they slit your throat right there, then you can have an emergency airway put into that location. Now we go all the way down to the littlest branches. We call them bronchioles. Now, what is the difference structurally between a bronchiole and a bronchi?
It loses its mucus.
Size is smaller. What else?
It loses its mucus.
We don't have any mucus glands down here, because if we made mucus down here, what would happen?
It would fill the tube.
Yep, we're going to fill up the lumen. And then for structure, obviously we have hyaline cartilage up here. What do we have for structure down here? Smooth muscle. What do we use that smooth muscle to do?
Gas exchange.
Yeah, what's the word for,
Diffuse. Osmosis.
Inflate.
he called it contraction, but there is a name when we take a bronchiole and cause it to get bigger and smaller.
Bronchodilation.
Bronchodilation and
Constriction.
bronchoconstriction. And the tissue then, if we're not making mucus, we're not going to have pseudostratified. What kind of epithelia would line that bronchiole? Simple what?
Squamous.
Nope. You went one step too far. Cuboidal. Simple cuboidal. Then we get into this structure called alveoli. Which of these structures that we just covered is considered the functional unit?
Alveoli.
The alveoli. And why do they consider the alveoli to be the functional unit of the lungs?
Exchange.
Because that's where we get gas exchange. And how many different types of cells are found in the alveoli?
3.
3. We have a type 1 alveolar cell, which is what?
But type 2 has the surfactant.
What is it? Simple squamous. What process happens across the simple squamous epithelium?
Exchange.
What's that
Diffusion.
process called?
Diffusion.
Diffusion. Because oxygen can come right across the membrane and carbon dioxide can go right across, going out. So that is where we have the gas exchange through the process of diffusion. And why do we have simple squamous epithelia? Because diffusion only works across
Small
short
spaces.
distances. If I had cuboidal in here,
Can't do it.
it would take that oxygen and CO2 so much longer and you would not be able to exchange enough gases to stay alive. So if you ever think about somebody with pneumonia, have you been around somebody who has pneumonia? How do they breathe?
Awful.
Yeah, it's very labored, right? What you are witnessing is the fact that when you have pneumonia, fluids build up on the surface and thicken the respiratory membrane. What does that do to the amount of gas exchange? Decreases it, which why you are witnessing labored breathing when somebody has pneumonia. Okay, your type 2 alveolar cells produce what product?
Surfactant
Surfactant. What is the purpose of surfactant?
reduces the surface tension.
Reduces surface tension. And to help you remember, what creates the surface tension?
Hydrogen bond?
Hydrogen bonds. The hydrogen bonding between the water molecules create surface tension. That has a tendency to make the alveoli collapse. You don't want the alveoli to collapse, so we break those bonds with the surfactant. That's what they call reducing surface tension. And the third type of cell, which you would find for cleanup purposes in the lungs, alveolar macrophages. Because obviously you're going to inhale some dirt particles, some pollen particles. You're going to get bacteria in there. You got to have something to gobble up those structures. Okay, what is the name of the structure which adheres the lungs to the rib cage and the diaphragm so that you can move air in and out of your lungs? The pleura, the double-walled serous membrane. What does smoking cause to occur in the larynx, the trachea, and the bronchi?
COPD.
That's happening more in the alveoli. Think of location. Location. What happens when you chronically smoke cigarettes in the larynx, the trachea, and the bronchi?
You kill cells.
What part of the cells get damaged?
The hairs.
What are those called? Use our big girl words. Come on.
Microvilli. Cilia.
Cilia. You have microvilli in your small intestine. This is a different organ. Cilia. And it paralyzes or destroys the cilia. And the result of that is
Smoker's cough.
smoker's cough.
Can take.
Now, if you stop smoking, will those grow back?
Yes.
Yes,
Possibly.
because the DNA is still intact. So you can grow those back if you choose to quit smoking. All right, so that covers that homeostatic imbalance. We covered the functions of those, functions of the larynx. I think that might be, let's see. Did it? Did it? Did it? Did it? Did it? There's your pleura. Yeah. Uh-oh. How many lobes do we have on the left lung?
2.
How many do we have on the right lung?
3. Oh, 3. 3.
Let me see that lung of yours. Show me. That would be very interesting. Yep, we covered the structural differences between the bronchi. What was unique about the carina? You guys remember?
That's the bridge.
Okay, what's unique about it?
It splits.
Okay.
Flexible.
I don't remember.
So this last cartilage right down here has the name of carina. What sensory receptors are embedded in the epithelia inside that location?
Violent cough.
The reflection.
Violent cough reflex in the event that you aspirate or inhale liquids or food particles into your lungs. Hey, you got that one. I wasn't coughing up a fur ball. All right. We got it. That's your respiratory chapter. Okay, so then we get to our digestive system chapter. And I think I want to go to the end and start because we can ask a whole lot of questions based upon this picture. All right, so structure number 1 represents the
Oral cavity.
oral cavity. I noticed a bunch of people put down mouth, and I gave you credit for it on your quiz, but that sucks. Use your big boy, big girl words, oral cavities, mouth. It's so late, people. What happens to the food when you ingest it and put it into your mouth?
Mechanical digestion.
Yes, we're going to chew it up. So we have mechanical digestion of the food going on. What is the term called when we mix and chew the food up? Mastication. Got that one down. So mastication occurs in the mouth. What type of teeth are these?
Inside.
Incisors. What are these?
Canines.
Canines. And the back ones?
Molars.
Those are molars for grinding and chewing. And we mix it with saliva. Some of the saliva comes from this one, parotid, and this one,
Submandibular.
submandibular, because this is the one under the mandible. And then you can see this one's right under the tongue, so we're going to call it sublingual. What are functions of saliva in your body?
They break down stuff, right?
One specific nutrient begins the chemical digestion in the mouth. What is that nutrient? C word?
Calcium.
Think about our nutrients. Nutrients come in 4 main categories: nucleic acids,
Calcium.
proteins, lipids, and carbohydrates. So what begins digestion in the mouth? Carbohydrate digestion begins with a enzyme called salivary amylase. Okay, what else does it do to the food? What's the condition of a lot of food when we start chewing?
It's really big.
It's solid. It's like,
And it's
Heavy.
not wet.
yeah.
Oh yeah.
Saliva
So
gets it.
Lubrication.
lubricate the fluid so that we can swallow it. And then saliva also in between meals
Cleanses your mouth.
cleanses your mouth, rinses the food particles out. Because if you leave food particles in your mouth, bacteria will
Grow.
Feed on it.
feed on it, creating
Cavities.
step
Acid.
in between. You're
Acid.
jumping to the punchline. Go through the steps.
Acid.
Bacteria create acid, then the acid etches the
Enamel.
enamel, which creates
The cavity.
one baby step at a time, damn it. All right. If you understand the story, it's easier to recall it. It really, truly is. And think about all of these as stories. Okay, so once you chew up the food, you mix it with saliva, you water it into the ball in the back of your tongue, and we call it a
Bolus.
bolus. You swallow a bolus, and it goes into the
Esophagus.
one step before. There's an organ in there. Pharynx, and then it goes into the
Esophagus.
esophagus, and finally into the
Stomach.
Now along the way, it passed by a couple of sphincters. What would be the sphincter here? Upper esophageal. Its main job is to,
Close off airway and digestive.
okay, it does, and so then when you swallow, it has to open up and allow the bolus pass, but in between, it's closed, and it prevents what from coming down in your stomach?
Gas.
Air, so that you're not having to burp up air all the time. And what's this one called down here?
Your liver.
Lower esophageal or gastroesophageal. What's its job?
To keep
One-way valve.
Going back up.
to prevent the stomach acid from splashing back up, and that condition is called GERD.
And heartburn.
If it fails, then you have GERD. Then that bolus goes into the stomach where it's mixed with gastric juice and becomes chyme. This part of the stomach here is called the,
Oh.
named after the heart,
What? No.
named after the
Cardia.
heart,
Cardia.
cardia region. Then you get to the hump called the F word, not that one.
Fundus.
Fundus. Then it goes into the main part of the stomach called the,
Body.
and then it goes to the pointy part called the
Pyloric.
pyloric region or pylorus, and that helps you remember because it ends in the
Pyloric sphincter.
pyloric sphincter, which then regulates the release of chyme into the first part of the small intestine. The inside of the stomach has pleats called rugae, which allow it to expand. The stomach is a little different than the rest of the GI tract in the fact that it has one extra layer of
Elastic.
muscle. You normally have longitudinal muscle, circular muscle. Stomach has an oblique layer also. Speaking of which, the tubes have 4 basic layers of tissue through the whole GI tract. What do we call the very inner layer?
Into my
That's a blood vessel.
Viscera.
It secretes mucus. So we
mucosa.
call it mucosa.
Yeah.
And then the layer outside of the mucosa, under the mucosa, is called submucosa. And then you have 2 layers, which collectively are called
muscles.
muscularis externa. That's your longitudinal and circular layers. And then around the outside, you have little offshoots of the peritoneum, which wrap around it, which we call the serosa. Okay. So the chyme, the acidic chyme, is released into the first part of the small intestine called the duodenum. What did I want you to remember about the functions of the duodenum? What happens to the chyme?
It's neutralized.
It's neutralized by what?
The juices from the
Pancreatic
pancreas.
juices.
Pancreatic juice. And what is the chemical in pancreatic juice that will neutralize the chyme?
Bicarbonate.
Bicarbonate, HCO3 minus. And the duodenum also receives secretions from the,
Gallbladder. Liver.
what is the name of that secretion? Bile. What does bile do?
Dilute. Oh no, that's diluted.
Erodes?
I hope not.
Has enzymes that break down the food.
Nope, that's the pancreas. E word has to do with fats. Emulsifies the fats. Emulsifying fats is the process of taking large lipid drops and putting them into lipid droplets, little bitty ones. And that purpose then does what to the surface area? Increase the surface area, just like mastication. So mastication in the mouth to solid food is the same thing as emulsification of lipids in the duodenum. From the duodenum, which is a very short section, we move into a long section called the jejunum. What's the primary stuff that happens in the jejunum?
Chemical digestion.
The majority of the chemical digestion and absorption happens in the jejunum. Then we wrap up the digestion in the ileum, and at the end of the ileum, between the ileum and the large intestine, is another circular muscle called the ileocecal valve. cecum. Then it goes up,
Ascending colon.
goes across,
Transverse colon.
goes down,
Descending colon.
45,
Sigmoid colon.
last 6 inches,
Rectum.
Rectum.
ending in
Anal sphincter.
Anal.
anal sphincters. Four functions of the colon. We produce so we don't get constipated.
Mucus.
Mucus. We absorb
Nutrients.
so we don't have diarrhea.
Fiber.
Enzyme.
What would cause
Water.
diarrhea? Water and
Electrolyte.
yes. Water and electrolyte absorption. Because if you don't, you're going to be pooping out chyme, and chyme is basically diarrhea. Then we have our friends
Microbiome.
housing the microbiome. And then we're going to store. You store fats in your colon?
No.
Really? Show me.
Bacteria?
That's your microbiome. It's housing the microbiome. What did you say? What did you say?
Me?
Yeah.
Why?
What did you say? That's a clue. Did you hear what she said?
No.
Bacteria? What's your bacteria?
Oh,
Poop.
Feces. Storing feces for defecation. I told you had it right there. It's just like run with it. You don't
I
have to say
wasn't
that out
gonna
loud.
Say it out loud.
I say it out loud
I
all
know
the time.
you.
I'm bad. I'm the worst teacher you've ever had. Foul mouth, potty mouth thing. What is the condition called when we bear down too much when we're pooping? We can. Okay, you got that one down. Whoa. You remember the hemorrhoids, and
You
then
also get them in labor.
if hemorrhoids occur on the back of your legs, we call them
Varicose.
varicose veins. They're the same basic thing. They just give it a different name. Okay, what else have we covered? What if okay, what's the job of the gallbladder?
To filter.
To hold bile.
Not filter, to hold bile. What else does it do to the bile?
Oh, it dilutes.
Condenses.
it.
Another word for that is
Concentrates.
concentrates the bile. And so when we're concentrating the bile, we're removing what? What nutrients?
Acid. Oh.
Not acids. If you
Water.
water, yeah, if you concentrate Kool-Aid, you're removing the water, right? So what happens if you remove too much of the water from that bile?
Gallbladder stones.
Gallstones. Water
I
stones?
said gallbladder
Oh,
stones.
gallbladder stones.
Water.
You said water stones. I'm like, what the hell is a water stone? Gallstones. Good, plug it up. Okay, so we covered all the homeostatic imbalances. We talked about GERD. We talked about hemorrhoids. We talked about gallstones. I think that's might have. Functions of the liver. What is the name of that blood vascular system which
Hepatic
takes
portal
newly
vein.
digested nutrients from the stomach and intestines to the liver?
Hepatic portal vein.
And once those nutrients arrive at the liver, what does the liver do for them?
Filters it.
Okay, so it does immune surveillance on it, and it processes those newly digested nutrients. Because remember, the liver has your stores of what in between meals?
Glucose.
Glycogen.
Glucose in the form of glycogen. So we're going to restock our glycogen stores. And then another thing that we're going to do to those newly digested nutrients is if we happen to absorb some stuff that's really, really bad for us, the liver will work with the kidneys to do what?
Remove the toxins.
Detoxification. Yeah, so we're going to detoxify And let's see, and we make bile, I think that hits the majority of it. Nutrient metabolism, detoxification, and production of bile, so we got that. And we talked about the pancreas. There's your hemorrhoids. Got that. Oh, let's talk about pooping real quick. Okay, so I want this, pooping and peeing are so similar to each other. What was the stimulus for urination?
Full bladder. Stretched bladder.
Stretch, so what's the stimulus for pooping?
Stretch rectum.
Stretched
More
rectum.
specifically, what part of the colon?
The rectum.
Stretch rectum. When feces moves into the rectal vault and stretches it out the last 6 inches, that's your trigger to poop. And I think y'all can relate to that because when you have to poo, if you happen to sit into a chair, you feel that pressure back there? That's the feces sitting in your rectal vault. That's that stretch that is triggering that sensation that you need to poop. So when you when you stretch out the rectum, it's going to send that information to the spinal cord. What kind of a nerve impulse is the spinal cord going to send back to your internal sphincter?
To open.
Yeah, but tell me about the nervous system that controls this, because you know about that.
Muscular.
Oh yeah.
The parasympathetic.
Okay.
Somatic.
What?
Somatic. A parasympathetic.
Yeah,
You said
think about it.
first.
Is this under voluntary control or involuntary?
Involuntary.
It's involuntary. And when is which part of that autonomic nervous system is it appropriate for pooping and peeing?
Parasympathetic.
Parasympathetic. So it's a parasympathetic motor command that then tells this internal sphincter to release. In the meantime, that information is going to your brain. You become aware of the fact that you have to poo. And when you have the opportunity, the correct opportunity, hopefully, you will send what kind of a command to your external sphincter made of skeletal muscle? A somatic motor command to allow you to poo. So pooping and peeing, they're identical almost, except what they regulate. Poop and pee, feces and urine. All right, we did it. Oh, I know what we gotta do. Teeth. Everything above the gum line is crown. Everything below the gum line. Hardest substance, bone-like structure, and living stuff.
Pulp.
Pulp in the pulp cavity. What holds the tooth in the socket?
Periodontal ligaments.
And what covers the root? Sounds like concrete. Cementum. How does the living stuff get there?
Root canal.
Through the root canal. All right. Yes. What was your question or your comment?
Oh,
Pooping.
so I had a question. Well, not even like
We had. Okay, here in this. Okay, our last system, urinary system, and we need to add 2 more, so 5 and 6. 6 functions of the urinary system. The most obvious that you were taught in chapter 1 is to
Filter blood.
filter the blood, and the purpose of filtering the blood is to
Make your metabolic waste.
remove metabolic waste. And then, since we make 160 to 180 liters of filtrate every day, and we have to reabsorb a lot of those valuable nutrients, while we're reabsorbing it, we're going to bring what into homeostasis?
Metabolic.
What? Okay, that'll be one.
Electrolyte balance.
Acid-base balance, and here we go. Fluid and electrolyte balance. So basically, we're going to choose how much water do I keep in my body. Let's make our fluids in balance. How many salts do I keep in my body? I'm going to bring my electrolytes into balance. Since I'm reabsorbing 99% of 160 liters, I got plenty of opportunity to bring everything into homeostasis. And in the meantime, I'm going to adjust the pH of my body, because if I am too acidic, what will the kidneys put into the urine? If I'm too acidic, hydrogen ions. Remember, that's the measure of pH. And if I'm too alkaline, what will my kidneys put into the urine?
Base.
What base? Bicarbonate. So they can directly control pH, but they do it slowly because you don't make that much urine every day, typically. And indirectly, if I regulate fluid and electrolyte balance and I have my fluids just right, I also bring what other variable into homeostatic balance?
Blood pressure.
Blood pressure regulation.
Red bone
Blood volume.
marrow. Red blood cells.
And while we have all that blood going through the kidneys, we're going to regulate red blood cell production. Okay, what is the stimulus to start this feedback? As the blood goes through the kidneys, it senses that oxygen levels are out of balance. That condition is called? Anybody remember it?
Can you ask the question again?
If the blood flowing through the kidneys, if the chemoreceptors in the kidneys sense that there is not adequate oxygen content in the blood,
Oh.
that condition is called
Hypoxia.
hypoxemia. And they are going to then stimulate red blood cell production by secreting a hormone called
Poetin.
erythropoietin. So, poietin, creation of erythrocytes, red blood cells. Because if I make some more red blood cells, they can then carry more oxygen. And then number 6 is other metabolic functions. And you are not going to give that to me as a function. You will come up with one of these.
Glucogenesis.
Okay, gluconeogenesis. You did really good. You got the first two. What does the neo mean?
No.
New. So creation of new glucose molecules from fats and muscle cells, proteins. And why is it important that we have to have the ability to make glucose at all times?
For the brain.
Neural cells require it. And I'm going to put the finishing touches on which nutrient that helps with calcium absorption.
Vitamin D.
Vitamin D. And I'm going to work with the liver.
Enzyme.
Detoxification. All right. So we got our functions down there. Now let's go to our labeling diagrams. Okay, structure A represents the kidneys, which make the urine, and then the urine is transported on tubes called
Ureters.
ureters, temporarily stored in the urinary bladder, and then out through the
Urethra.
urethra. What is the main muscle which makes up the bulk of the bladder?
Oh. No. It starts with a D. It's
Oh,
the
it's irregular?
Duramater.
That's the name of a muscle.
Detrusor.
The detrusor muscle. Detrusor. And the epithelia, which lines the bladder and the ureters, is called
Transitional.
transitional epithelia, which has the unique ability to
Expand.
stretch without
Leakage.
leaking, because you don't want that urine to leak back into your body once it has been made. What's the difference between the male and the female urethra?
leak.
The
Leaks?
distance.
Leak.
Distance.
Length. Well, I was like, what? It leaks. Length. Yeah, I'm having a hard time understanding her today. Length. Men's is usually longer, and do they both have the same exact functions?
No.
No.
What's the
One
difference?
has semen, and the one.
Which one might have
Oh,
semen?
the boys. Yeah, the male.
Yes, the
obvious
male
one.
urethra carries semen and urine, whereas the female's urethra carries urine only. All right, labeling diagram. What are the double-headed arrows mean?
Region.
Region.
Region. So the outer region is the renal cortex. The inner region is the
Renal medulla.
renal medulla. And the structure outlined here with three sides is a renal pyramid. Renal pyramids are separated by,
Renal columns.
and then the filtrate will get down to this point,
Renal.
and it will be called
Urine.
urine. Urine drips into a,
Minor calyx.
which merges into a
Major calyx.
major calyxes create the
Abdominal pelvic.
Renal pelvis.
Cavity.
renal pelvis.
Abdominal.
She went to a whole different location there. Where everything comes in and exits, renal hilum, and then the urine will travel out through the
Ureter.
ureter. How many different types of nephrons do we find in the kidneys? Two. What's the name of the one that hangs out? Most of it's out here.
Cortical.
Cortical nephron. And are they the majority or the minority?
Majority.
They are the majority. They make up 80%, and they just do everyday filtering and homeostatic regulation. Then we have another one whose renal corpuscle is here, and their nephron loop goes clear down to the bottom of the medulla. Juxtamedullary, next to the medulla. And its special job is to give you the ability to
Dilute or concentrate.
make concentrated or dilute urine.
She made the jelly steams, not steam.
Oops, I'm going the wrong way. Ba-da-ba-da-ba-da-ba-da. I want to get to the, right past this. Let's practice our different parts of the nephron. So, what is the functional unit of the kidneys?
Nephron.
Nephrons. And why would you think the nephron is the functional unit?
Because that's what filters it.
Because that's where we filter the blood, we reabsorb the nutrients, and we create urine. So that's obviously the functional unit. Each nephron has two main components. This is one main component. We call it the
Renal corpuscle.
And what is the one and only thing that the renal corpuscle does?
Filtration.
Filters the blood. So when we look at our cross section of a renal corpuscle, what is this part of the renal corpuscle? That is your renal capsule, and then this part is the, what do we call them?
Peritubular.
Nope.
Oh, that's the other
G word.
one.
This is the glomerulus, and it is made out of what type of capillaries? They have large oval pores, and they're designed for filtering. Fenestrated capillaries. But the filtration membrane isn't made up of just fenestrated capillaries. It's fenestrated capillaries with an additional cell on the outside that creates filtration slits. And the name of that cell is the P word. Podocytes. So it is the fenestrated capillaries. You see how they paint this in white and this is in red?
Mm.
The red represents the capillaries. That's the fenestrated capillaries. And when you add the podocytes on top, they're white. So that's what creates the filtration membrane, is fenestrated capillaries plus podocytes. In the renal corpuscle, two parts: renal capsule, which captures the filtrate, and the glomerulus, which filters the blood to create the filtrate. What is the name of the blood vessel that brings blood to the glomerulus for filtration?
Afferent.
Afferent arterial. Afferent takes it to, and then the what takes it away?
Efferent.
Efferent arterial. Okay, then the other main parts of a nephron is the
Loop.
the whole thing.
Tubules.
Tubules. So renal corpuscle and tubules are the two main parts of a nephron. Then the tubules are divided into subdivisions, which each have a specific function. What is this part of the tubules, which is closest?
Proximal.
Proximal tubules. And what did I want you to remember? What function happens here?
65%.
Reabsorbs the majority of the nutrients, at least 65% of the fluids and electrolytes, and 100% of what they call nutrients. What they're saying is amino acids and glucose and vitamins get absorbed here. Then it goes into this part called the descending nephron loop, and its one job is to
Reabsorb 20%.
reabsorb water only. Then we go into the,
Ascending.
and
And
its
it's
one job
salt
is
only.
reabsorbing salts only. By the time we get to this point, we have reabsorbed at least 90% of everything, so all we have to do is tweak it to adjust for your body's
hormones.
physiological needs. So we call these the
This
distal tubules, and their one job is
Hormonal.
secretion.
hormonally driven
Reabsorption.
reabsorption and secretion. So let's go back to the very beginning so you understand why this happens. You have two forms of communication in your body. You have electrical communication, which is done by the nervous system, and then you have another kind of communication, it's chemical communication with hormones. We tell bodies things what to do with hormones. It's communicating. So we can tell these kidneys, hey, keep some more salt. You do that with a chemical called aldosterone. Hey, get rid of some salt. Atrial natriuretic peptide. Hey, keep some more water. A hormone called antidiuretic hormone. Or, hey, create some more, or reabsorb some more calcium. That's the job of parathyroid hormone. So it's chemical communication using hormones, hence hormonally driven reabsorption and secretion. And then all of these connect into this structure called a,
Collecting duct.
and the collecting duct is also influenced by hormones. The two things that this is known for, and this is a physiology thing, just to help you out here. This collecting duct is especially good at adjusting for pH, so we can put a lot of hydrogen ions in here and get rid of hydrogen ions when we're acidic. And the other thing that's really good for is reabsorbing water. So if there is one structure in your kidney that creates that really dark, concentrated urine when you're dehydrated, bingo, that's the job of the collecting duct.
Drink more water.
All right, so we covered that.